dignitaries on the dais, Sri Honorable Minister Ghulam Nabi Azad, Dr. Robert, Dr. Joe Thomas, and friends, and dignitaries in the audience, as well as representatives from various countries, researchers, practitioners, friends. I was very impressed by this report and the depth of the insights that this report brings about. The report titled Population Trends and Policy Options in Selected Developing Countries has been edited by Dr. Joe Thomas, and it's first in the population series from the PPD, and it's been supported by the Population Communication USA. The report covers and has an elaborate overview chapter, and the authors of the overview chapter look into the performance of select 9 countries out of the 25 countries who are members of this PPD. The chapters cover Bangladesh, Bihar, Ghana, Kenya, Mali, Nigeria, Senegal, Uganda, and Zimbabwe. The overview chapter broadly highlights the fact that all the countries, while they are going through various shifts and changes and have been placing a lot of emphasis on population stabilization issues, do face a lot of challenges. The PPD obviously provides the forum for being able to share the experiences of these countries and draw strategies to bring about changes in the future. The country case studies attempt to capture the performance of these countries vis-a-vis the ICPD commitments and also review the progress being made. And obviously all the chapters highlight the bottlenecks that these countries are facing and the challenges that they are facing. And it's interesting to note that despite the wide variations in geographies and histories of countries in South Asia and in Africa, they do present very interesting commonalities and also very interesting differences, thus providing a lot of opportunity for cross-learning. Almost all the countries covered in the report have registered declines in population growth rates and total fertility rates. However, as the Minister has just pointed out, they range from a low of 1.1 to a very high of 3.2, or the total fertility rate of 2.3 of Bangladesh to 6.7 of Uganda. Most countries, while they do seem to be performing and trying to attempt to move towards better performance, they do have within these countries regions that are far more difficult and regions which are not so easily amenable for shifts and changes. And very often they refer to cultural norms and practices, low age at marriage, and high son preference, and also cultures that have a lot of value to having many more children as major stumbling blocks to bringing about changes in population stabilization issues. Geographical accessibility, low levels of literacy, ethnic and cultural norms, as well as low age at marriage, early age at cohabitation, non-acceptance of small family norm, non-acceptance of contraceptive prevalence, so on and so forth, were also often found to be associated with education of women and the economic status of the households. All the countries have several population policy related documents and commitments with programs in place, and also have several commissions that regularly monitor to see whether performance is as per the policies. Most of the countries have attempted to reach through expansion of services, training of traditional birth attendants, and providing community-based women health workers to reach out. Very often the reports also talk about partnership with non-governmental organizations as well as media to provide information and also bring about shifts in the behavioral practices of people. However, the daunting task for most of these countries is often in terms of reference to young population, large young population, which in itself propels population and keeps up population momentum and growth, which needs to be something that's to be worked on. And of course, many countries also have concerns around HIV and AIDS. However, I figured that there are many more themes that can be explored, and that probably is the good news. This report, since it says it's the first report in the series, obviously one would see that there will be many more such reports that would come in, and this report provides pointers for a lot of those reports that can come in future. For example, I felt if countries are talking about cultural barriers, it's still not very clear that how countries like Bangladesh and Indonesia, which is not a member in the PPD, how is it that Indonesia is able to manage given the same kind of religious and cultural configuration? So obviously there's a lot to learn as to how some countries manage despite these barriers and how some countries are not able to. Most of the case studies don't tell us enough about the development part of the population and development equation. There's a lot of emphasis on population issues, on contraceptive prevalence, on small family norm, on issues to do with fertility regulation or abortions, but they do not tell us enough about how economic programs, especially structural adjustment programs, and also TRIPS and GATT, the new trade regimes, actually impinge on the health sector performance as well as the emphasis on population programs. We're also not very clear, and we are aware that most of these countries have a large private medical sector. It's not very clear how these private medical sectors and the pharmaceutical lobbies in these countries are actually being regulated and harnessed by these countries in order to make it possible for working for poor people as well as working on population issues. There are also several human resource issues in these countries, and the report definitely can explore in the next set of its volumes how are the human resource issues actually being managed and handled, because that's a huge issue, especially with a lot of brain drain of doctors and nurses from the global south to the global north. So the key concerns that need further attention by the august house here and also countries is how does one harness the demographic dividend, and how does one learn from each of the other countries in terms of higher education and also various levels of education and training and capacity building as well as vocational education that can only harness the dividend into something that can be positive rather than leading to greater problems in all these countries. The need to recognize sexual and reproductive rights of men and women, particularly that of young people, is something that cannot be compromised at all. And then to bring about greater convergence to address population issues with development and also consider population as a cross-cutting issue across all other sectors within each country. The report also does not adequately tell us about violence against women, and it is a concern in all these countries. And we know women often do not report, but at least 45 to 70%, that's the range of women who experience violence against them in public places, in communities, and also in homes. So how does one deal with domestic violence? How does one deal with intimate partner violence and other forms of violence, and deal with it as a public health issue and develop responses from the health system perspective? This is something that needs to be further explored, not only in the report, but also by all these countries. We need to work on strengthening capacities in evidence-based research for health planning, program development, implementation, and monitoring. And I think many of these countries have huge intellectual capital that needs to be worked on. How does one strengthen human resources in the sense doctors, nurses, technicians? There's a huge dearth of trained personnel in most of these countries. And how would countries across the partner membership actually enhance the possibilities for training across these countries? What are the experiences of public-private partnership in the member countries? What is the role of private health sector in all these countries? What kind of regulatory systems exist to ensure that people do not get into a spiral of poverty-seeking private medical care? I think these are definitely concerns that need to be looked into. And my last set of slides, countries need to prepare to work on a broader set of ideas to work with young people on economic and health issues. We need to also understand that while countries do often refer to a one-child norm, very often the experience has been that it leads to greater anti-female sex ratio or a skewed sex ratio that goes against girls and women. As I said, there's a huge intellectual capital, and that needs to be explored across these countries. And particularly, I feel that we need to work at a greater extent to produce books and maybe a journal focusing on these countries in this region, and also maybe an open source e-journal. Collaborative research and subject-specific journals should be seriously considered. Thank you very much.